Chicago's former top doctor is speaking out about her firing just days after it happened.
Medical reporter Dina Bair sat down with Dr. Allison Arwady to reflect on her 8 years of service to the city. Dina joins us now with more.
Ben and Lourdes, as commissioner of Chicago's Department of Public Health, she helped Chicago navigate the pandemic, offering guidance and answers. And while she doesn't have all the answers when it comes to her sudden firing from the post she loved, Dr. Arwady says she'll always be a champion for public health and patients.
So I'm going to share a little bit of data and a little bit more detail.
She was always on call.
When I look back, I'm not thinking about the way that it ended.
The internal medicine specialist who chose public health over private practice showed her competence and commitment during the rigors of COVID.
It's been really the honor of my life to be able to lead my team through this, but it is a lot of the work that doesn't get talked about as much that I am in many ways the most proud of.
That work includes programs to support maternal health, fight opioid addiction, and boost mental health resources. All projects she and her team focused on while juggling the demands of the pandemic.
You know, we were the first time ever that we put mental health professionals to be part of 911 response. In the behavioral health space with the opioid crisis, right? We went from not even having a dedicated team to having Narcan in every public library.
She would have liked more time, but Chicago's new mayor decided her time was up, though Brandon Johnson wasn't the one to deliver the bad news.
In some ways, I consider it a badge of honor, right? That I have joined the hundreds of public health leaders across the U.S. who lost their jobs because they made decisions based on the data around COVID.
It was data that drove Dr. Arwady to encourage Chicago public school teachers and students to return to the classroom in 2020, a stance then CTU organizer Brandon Johnson took issue with at the time.
I put pediatricians, infectious disease docs, epidemiologists on looking at the data we had for kids and the people who took care of them. Let me tell you how closely my team was watching that data. It was time. I would make that decision every time again, even knowing it has had this consequence.
When Canadian wildfire smoke shrouded the city, creating a significant public health threat, it became clear to Dr. Arwady.
It is true that even at the emergency operations press conference, you know, they didn't want me. I was not able to do any media interviews, and neither was anybody on my team at that time. For the 3 months where Mayor Johnson was in, I really was asked and directed to not appear publicly.
But public health is in her blood.
I happen to be someone who my whole adult life has been really interested in infectious diseases and outbreaks.
Harvard, Columbia, and Yale educated, she spent several years with the U.S. Centers for Disease Control and Prevention, working with HIV and tuberculosis patients in Africa. She was on the ground when MERS landed in Saudi Arabia and during the Ebola outbreak in Liberia. This was not a job. This was a passion.
You cannot just fund public health when the crisis comes. We got an incredible influx of resources from the federal government during COVID, and we needed it. But as that is running out, you know, I'm looking at a 68, or I was looking at a 68% drop in our budget, right? And the last thing I want to see is all of that infrastructure dismantled. And my concern, not just here in Chicago, but across the country, as COVID thankfully is waning, we're going to forget about public health.
But Dr. Arwady won't forget Chicago.
That curved facade is not only looking interesting, it is matching. And this is my home. This is my city.
And you will still find her along the Chicago River. She guides an architecture tour. In fact, she did so this afternoon, right after our interview. Tonight at 10, hear Dr. Arwady's thoughts about the latest COVID resurgence. Still educating, even unofficially. She says she will always raise her public health voice.
Yeah, but she ran afoul of Brandon Johnson and the Chicago Teachers Union by pushing for that school reopening. So that's the history there.
Right, and the data she says that she looked at then was very important. The data afterwards backed her up in the studies long after COVID.
All right, looking forward to the rest of your interview tonight. Okay, thank you,
Thanks,
Dina.
Dina. As Chicago